So I know this is the first time you guys have been through this, so just kind of relax. We want you to treat this and perform your assessments, and it was a real dispatch, so just kind of go about it as if it's, any other call you've been on, and many more that you'll be on in the future. But one thing we do need you to do is you must verbalize aloud everything you're thinking and doing. If you don't know what you're thinking and doing, we can't give you credit for it. You have an invisible EMT partner that you can say, I would have my EMT partner do this or do that, and we'll, tell you for some reason they can't do that. Otherwise, we'll let them do whatever you want to, however you want to direct them. Treatment should be limited to what you've covered in the class at this point. So we haven't gotten a lot into the advanced treatment. So it's really all about assessing. It's really all about assessment, and making sure you do a good job with that. You've got 10 to 12 minutes to complete your assessment. You get to 15 minutes, we're going to tell you, time's up. So be cognizant of your time, and you should have plenty of time to do everything you can do. So any questions? Okay. Greg's going to give you the scenario and we'll get started.
Righty. You've been dispatched to a residential area for an ill person. No other information is available at this time.
Okay. BSI, scene safe.
Absolutely.
Nature of illness is ill person. Consider additional resources.
None required.
Number of patients is 1, and consider ceasefire as we get there.
No indication.
So it was approach a patient, SEO female in her early 30s, laying in bed. Doesn't appear to be in any type of distress at this time. Hi, my name is Andrew. I'm a paramedic with the ambulance. What seems to be going on today?
I have like indigestion.
Indigestion?
Mm-hmm.
How long has that been going on?
About a half hour.
About a half hour. Okay. At this point, I've assessed that she has a patent airway. She's able to speak in sentences. She is breathing adequately, and she does have a regular rate and rhythm for her heartbeat. Skin is warm and dry.
Her skin is actually cool and moist.
Cool and moist, thank you. So about a half hour, you said? Does anything make that better or worse?
No.
Okay. Does that pain move at all?
No.
Just sitting right there. How would you describe that pain?
Just like that pressure sitting.
Okay. Scale of 0 to 10, 0 being no pain at all, 10 being what I would consider childbirth. About a 4. Okay. In about a half hour. Do you have any allergies to food or medication?
Penicillin.
Penicillin. Are you currently taking any medications?
Yes. I take Mevacor, Cardia, and Nitro.
Okay. Has this ever happened to you in the past?
Yes. About a month ago, I was in the hospital.
And did they tell you what it was in the hospital?
No, I have no idea what I was doing.
Just decided for had a 4-day vacation. Okay. When was the last time you ate or drank anything?
About a half hour.
About a half hour ago. And what did you have to eat then?
Just a light breakfast.
Light breakfast? Anything like spicy or so kind of like a light kind of breakfast? Okay. And what were you doing before this pain started?
Just watching TV.
Just watching TV. Okay. This time I'd go ahead and have my EMT partner get me a set of vitals. And then I'll continue on while we wait for those. So, do you have any heart history at all?
I have hypertension, CAD, and my cholesterol.
Okay. And you're currently being treated for the hypertension?
Mm-hmm.
Okay. Are you taking anything for the CAD? Okay, do you have any? Do you have a cardiologist? Okay. So I'm going to go ahead and just take a listen to your lungs and to your heart. Okay.
And your vital signs: pulse of 100 and regular,
Okay.
BP of 160 over 90, and respirations are 24. And the SpO2 is 97% on the room air.
Wonderful. So I'm not going to continue with oxygen at this time, but we can reassess if need be. So just go ahead and take a couple of deep breaths from me. One more deep breath. as long as I'm I'd like you to breathe just. Forward. Couple more deep breaths. Find the lungs to be clear, equal bilaterally. Looking at, and also be looking for things like abnormal rise and fall, any pulsating masses or anything like that. So that like pressure in your chest, so it doesn't move, but does it get better or worse at all, or just constant?
Yeah.
Did they give you any medication that you know that's helped with this? I know it seems like a barbaric, but. Okay. Do you have any nausea, vomiting, dizziness, lightheadedness? Nothing, just this is only complaint for you. Okay. Wouldn't necessarily say that this is a priority patient at this point, but we'll go ahead and transport, and we can finish up a detailed assessment in the ambulance. So, have you ever had any abdominal problems before? Okay. So, looking at the abdomen, I'll be looking for any pulsating masses. Again, any abnormal distension or anything like that. I'm going to go ahead and take a listen here. Sorry. I cut myself on your nails. Does that count? Sorry. Listening for no more than 2 minutes for vowel sounds, which I find to be normal at this time. I'm going to go ahead and press on your belly. Just let me know if this hurts at all. First, you're going to do light palpation, all 4 quadrants. Is anything there? Just let me know if anything changes the pain, okay? And again, you're going to press a little deeper this time. Okay? Any of that make it better or worse? So, never had this happen, or had this happen before. Hospitalized for 4 days. Not sure what the diagnosis was in the hospital. For future reference, you want to hang on to the discharge paperwork. Any prior history with like acid reflux or anything like that? If you lay down at night, do you notice like a burning sensation in the back of your throat?
No.
Okay. So I'm going to go ahead and finish with the cardio exam, checking for pedal edema, which I'm not finding any. Checking for pedal pulses.
You have strong distal pulses.
Strong distal pulses. All right. A couple other things. Just go ahead and switch my hands for me. Great. And a pen light. I just make sure that my eyes, pupils are reactive. Again, not seeing any accessory muscle usage as far as breathing is concerned. Color is still adequate. Just have that diaphoretic and clammy skin. So at this point, I'd say that my field impression is that we're somewhere between a possible cardiac event or legitimate indigestion. But given the treatments that we have covered at this point, I am not able to continue any further. I believe that is all I have.
Anything you want to change or do differently?
Sure, I just don't know what it is.
Okay.